In this video, we will continue discussing early effects of radiation by defining acute radiation syndrome, or ARS, and categorizing its stages, including thresholds, symptoms, and durations. We will describe symptoms and prognosis of acute radiation syndrome's subsyndromes, and lastly, we will analyze the mean survival times of those who have experienced ARS subsyndromes. Now that you are familiar with thresholds of both total body and partial body exposures, I would like to review the progression of acute radiation syndrome, or ARS. With ARS, the exposed individual goes through a progression of stages that vary in severity and length depending on the amount of radiation dose received. This progression of effects begins around 100 rem. At higher doses, the individual will go through the stages more quickly and result in death sooner. At doses closer to 100 rem, the individual will likely recover, but the stages will be a longer progression. ARS can sometimes be referred to as radiation sickness or radiation toxicity. There are 4 stages of acute radiation syndrome. They are sequential and include the prodromal stage, latent stage, manifest illness stage, and in the last stage, the exposed individual either dies or recovers from the radiation injury. We will review each stage individually, including the associated symptoms and timeframes. The first stage of acute radiation syndrome is the prodromal stage. In this stage, the individual experiences NVD syndrome. NVD syndrome includes nausea, vomiting, and diarrhea. In addition, they may experience flu-like symptoms that include fever and fatigue or a feeling of being faint. However, you should know that individuals can experience NVD syndrome independently from ARS when the dose is between 50 and 100 rem. Once the individual receives a dose of approximately 100 rem, they will likely go through all of the stages of ARS. The prodromal stage lasts a few hours to a few days depending on the dose received. After feeling ill, the individual experiences a period of recovery where no symptoms are experienced, but this is short-lived and only lasts for a few hours to a few days depending on the dose received. It's the calm before the storm. The impending storm is the third stage, or the manifest illness stage. This is when the individual experiences the prodromal symptoms again, so the nausea, vomiting, and diarrhea are back along with other flu-like symptoms. And depending on the dose, the individual may experience subsyndrome symptoms as well. The manifest illness stage can last several hours to a couple months. Subsyndromes of the manifest illness stage are determined by the dose received. There are 3 syndromes including hematopoietic syndrome, the gastrointestinal syndrome, and the central nervous system syndrome. As you may have already guessed, based on the dose thresholds listed, individuals that receive doses high enough to experience these syndromes do not survive their radiation injury. I want to take a few moments to discuss the 3 subsyndromes, their symptoms, and durations. Hematopoietic syndrome, also called bone marrow syndrome, begins to show in individuals exposed to 100 rem or 1 sievert. The radiation damage to the bone marrow results in a decrease in blood cell count. This means the individual will experience severe anemia, hemorrhaging, and infection. Those that suffer from hematopoietic syndrome typically die within 2 to 8 weeks of the radiation exposure. After reaching the threshold of 600 rem or 6 sieverts, individuals begin to perish from gastrointestinal syndrome, where the lining of the small intestines are compromised. The villi cells are destroyed by radiation burns, and in turn they are incapable of absorbing nutrients. This results in the individual suffering from dehydration and malnutrition, and after 4 to 10 days without being able to absorb water and nutrients, they die. At extremely high doses of radiation, even the radioresistant tissues of the central nervous system are affected. At 5,000 rem or 50 sieverts of acute dose, an individual will begin to develop central nervous system syndrome. In this subsyndrome, the individual experiences neural and blood vessel damage in the brain, causing cranial edema and pressure. Those suffering with central nervous system syndrome experience convulsions and coma before death. This subsyndrome is fast-moving, and the prodromal and latent stages are mere hours before the devastating symptoms set in and death soon follows. The mean survival time is typically 2 to 3 days with such high radiation exposures. One thing to understand about the subsyndromes of the manifest illness stage is that the dose thresholds are a guideline, and there is some overlap of the subsyndromes. The categorizations are meant to best identify which of the three the individual will likely die from based on data from a number of sources, including nuclear accidents and bombing survivors. As you can see from the graph, those that will perish from the bone marrow syndrome will live longer. For those that expire as a result of GI syndrome, their mean survival time is relatively the same because of the cause of death. As stated earlier, these individuals die from starvation and dehydration, and that range of time is pretty standard in all individuals, regardless of health and age. Lastly, we see that the mean survival time drops dramatically with CNS syndrome, meaning these individuals die rather quickly from their radiation injury. Depending on the individual's received dose and overall health, the last stage of the acute radiation syndrome determines the final outcome, death or recovery. For those that do perish as a result of their injuries, it's most likely from the three subsyndromes we just discussed. Some individuals recover, and it takes up to 2 years to recuperate fully. This concludes the overview of early effects of radiation exposure. In the next video, we will review the late effects of radiation exposure.